Hey there friends, welcome back to another yoga session with me, Agatha. Do you suffer from sacroiliac pain? Or you don't even know that it's sacroiliac pain. All you know is you have some pain in your lower back and you have no idea where it's coming from? Well, then you've come to the right video. In this video, I'll be giving you a little background on the SI joint, why there's a tendency for injuries there, a practice that will both relieve and help restore a little bit of the damage that you may have caused to your SI joints. And finally, be sure to watch to the very end because I will finish off with some tips on how to protect and avoid future injuries in that area. Let's start off with a little educational piece. Let's look at what that SI joint looks like. So what is the SI joint? It is where the spine joins with the pelvis, but more specifically, it's where the sacrum and the ilium meet, as you can see right here. These joints do have some mobility to them, but guess what? The pelvis was designed with a stability bias. However, with the crazy things that we try to do every day and the ways that we force our body and postural issues that we might have, we actually try to put or force these joints to be more mobile than they're actually structurally designed for. What are some of the contributing factors to having issues in your SI joint? Well, we have postural problems, so any kind of misalignment, and I'll show you exactly what I'm talking about, how you stand and how you move, biases to leaning towards one side or the opposite side of your hip. Pregnancy, ladies, pregnancy is a big one. Why? Because relaxin is released in our body, so we have these hormones that are designed to make us more flexible, but it's creating a great deal of instability in the pelvis. And of course, childbirth itself is giving and extending and spreading out those ligaments and those joints in order for us to obviously give birth to our kids. So the more children you have had, the more prone you are to instability in your pelvis. So core and pelvic strength are critical for stabilizing the SI joint. So join me now. We're going to do a practice that is going to help relieve any pain if you currently have pain and help repair some of the damage that's done. If you're looking for practices to really strengthen the region all around it to better support your SI joint, then click on the links here to some of my Pilates videos that do just that. All right, let's get on the mat. For today's practice, we will need a block. If you don't have a block, that's fine. Anything that is approximately the same thickness, it could be a pillow, a book, will do. Okay, put that over here in the back of the mat. You're going to need a yoga belt. Again, if you don't have a yoga belt, it could be some kind of a scarf, a regular belt, anything that you can wrap around your legs. And then finally, we have a bolster here, but you can take any thick pillow that you might have in your house, or also just a bunch of folded towels, one on top of the other, or folded blankets, one on top of the other, to achieve approximately this kind of size. Your torso is going to be on that later. Okay? So I just wanted to teach you a nice little trick that I learned from Donna, Farhi. So when you stand in a profile view, looking at yourself in the mirror, you know, we notice our curves, and we all have slightly different postures one from the other, right? But what we all do have in common is that we have this cervical spine, which has a curve. We have the thoracic spine, which has a curve, and we have our lumbar spine, which has a curve. And the reason why the spine is designed as this way is because that is how it is biomechanically structured to bear weight, okay? And to bear weight in the most even way possible and to allow weight to move down through our legs and through our feet. If these structures are compromised, so if we're doing a practice that is putting excessive pressure on these curves to move them or take them away or move them into extremities, we are doing damage. Or if we have a posture that is taking any of those curves out of its neutral position, we are also messing with our ability to move the weight down through the legs and through the feet. So what's happening is the pressure is going to start landing right into the lower back, and in particular, right into that sacroiliac joint, putting undue pressure on your body. So one way to check how you are doing is the greater trochanter here, which is the side of your thigh bone, okay, of your femur. The femur is your thigh bone right here at the top. You can feel kind of the protrusion of it on the side of your hip. So just align like a yoga belt or a block with it on the side of your hip and just see. So when we come to a nice neutral standing position, what you should see is that this strap is landing pretty much in alignment with my ankle bone, okay? Now, if I have a tendency to have, could be due to short hamstrings, it could be due to posture issues that I have, it could be due, with the curves of the spine, I have a tendency to tuck my pelvis in a little bit more. You will notice that immediately that line moves forward. So my strap is moving forward. It's no longer aligning with my ankle bone. And the same is the case if you have excessive lordosis. So this arching of the lower back, and it's now going to move back, and it's no longer aligned with my pelvis. So all of these possible positions are messing with my body's ability to shock absorb, to move the weight through my legs and my feet, and it's going to make it land right into this region, okay? Other problem that you might have is this tendency. Yeah, let's swing and sway and stay on this hip, put a leg behind, and just drop all the way to one side. And moms, we are uber guilty of all of this. One, pregnancy immediately puts us in this position. So we have to work very hard to have core strength, to have pelvic strength, to bring back the integrity to the pelvis. Stand straight, watch your posture, check yourself before we do the practice today. First rule of thumb in a practice that is going to help your sacroiliac joint is to focus on symmetrical postures, especially if those SI joints are inflamed and screaming, okay? We do not want to be doing asymmetrical movements and further dislocating or further stretching those ligaments. Stand at the top of your mat and make sure that your alignment is neutral. We just talked about that with that little trick with your yoga belt, how to check that you are standing in neutral alignment. Okay, so let's find that right now. Grounding through the feet, equal weight across all points of your feet. Abdominals are engaged, those ribs are connected. Shift the weight forward towards the toes, and on an inhale, we're just going to lift those heels off the mat a little bit and reach your arms right up to the ceiling. And on the exhale, press everything down together. Inhale, reach up. And exhale to press down with control. And if it's too much, you don't have the balance, then keep your heels down. Just lift the arms up. We're just trying to get some mobility going in the upper part of your chest and your back. Inhale in your shoulders and exhale. And two more. Inhale and exhale, press down. Last time, inhale. And exhale, press down. Okay, we're going to gently move down into a full squat position. Inhale, arms reach up. Exhale, take your time. If you need to have your hands on your thighs just to help you balance as you go down, press down. Release the neck. Let that whole lower back just soften to the mat to stretch and release. To come up, be sure to straighten your spine first. That's your inhale, arms reach up. And on the exhale, release the arms down. Again, inhale, arms reach up. And exhaling all the way down to the mat. Release the head down. One breath here. Inhale, stretch your back first, so you're lengthening, and then you're pressing up. And exhale down. And a few more times. Inhale up. And exhale down. One breath in position. Inhale, straighten your spine, pressing up. Exhale, lower the arms. Good. Three more. Inhale. Exhale, going down into your full squat. Release the head. Inhale, lengthen the spine, coming up. Exhale, press the arms down. Inhale, arms reach up. Exhale, down. Inhale, straighten your spine and press up. Exhale, lower the arms. Last time. Inhale, arms reach up. Exhale, down. Inhale, straighten your spine and press up. Exhale, lower the arms. Good. Okay, in a safe way for our spine, we're going to just bend one leg, press down on that knee, come to both knees and hands down, so we're on our hands and knees. Wrists are right under the shoulders. Okay, your knees are right under the hips, and we have our hips open, hip distance apart, so right under the hip bones here. Take a nice inhale, lengthening through the spine. Okay, on your exhale, curl your toes under, press back into your downward dog position. So just let the heels naturally reach down for the mat, connect the shoulders in your back, relax the neck. On a following inhale, come back to all fours, lengthen the spine. And on your exhale, you're going to sit back on your heels in child's pose. Here you can let your hands slide forward just a little bit. And you're going to be looking right in between your legs, so right at your crotch area, if we're being honest here, okay? And just notice if you have any tendency to shift the pelvis over to the left heel or over to the right heel. And that already shows you if you have a tendency to have more laxity on one side of your pelvis versus the other. So this is already your good indication of imbalances that are going on, and to help you start to fix that. So let's say that you have a tendency to go towards the left side, for example. Then you're going to press that left hand into the mat a little bit more firmly and reach through the opposite hip. So reach through the opposite hip. Here would be your right hip if you're pressing the left hand down. And you should see that start to correct itself. So let's come back up to all fours. Inhale, make sure you slide your hands right under your shoulders again. Exhale, press back to your downward dog. Okay, just helping get some release in those hamstrings. If you have tight hamstrings, another cause of what could be pulling your sacrum constantly out of alignment. Inhale, back to all fours. Exhale, back to your child's pose, and just check again. Maybe it's already starting to correct itself. If not, push through the hand where you're noticing that your pelvis is moving towards and reach through the opposite hip. Good, and let's do that one more time. Inhale to all fours. Exhale to downward dog. One breath here. And on the next inhale, come back to all fours, and one final time, sitting back in your child's pose, noticing any biases. Beautiful. Good, let's come up. Nice. Okay, next position. We're going to work on, this is just a way to trick your psoas muscles, so your deep hip flexors, into releasing, as that could be something contributing also to tension in the pelvis. So we're going to lie down on our stomach. Okay, you're going to bring your hands right into the groin region, so right into the hip flexors, just on top of your thighs and a little bit in towards the groin. This helps release the lower back a little bit more, but it also gives you feedback on tendencies towards leaning too much into one hip versus the other, okay? And I will link a great book where some of these exercises are coming from that explain all these things really in a beautiful way. So you can look for that in the description box. Okay, forehead is down. So very, very gentle. This is an adaptation of locust pose. So on an inhale, prepare. On the exhale, let's connect pelvic floor a little bit, connect into your abdominals, and you're going to lift just ever so gently both legs off the mat. Okay, inhale, bring them back down.
Let's do 2 more. Exhale, bring the legs up. And inhale down. And exhale up. Inhale down. And exhale, press it up. Inhale down. And last time, when you're lifting, you're trying to pay attention. Just, are there any tendencies? Is one side of your pelvis weighing more than the other? So is one hip bone pressing down more tightly than the other? Okay, good. Now we're going to do little figure 8s with the legs. So bring them up. And you're just drawing tiny, tiny figure 8s with your legs. 3 and 2 and 1. Relax down. And now you're going to lift again and reverse. Little figure 8s going the other way. Really small movement. 2 and 1 and release. Okay, slide your hands from under the hips, hands under the shoulders now. Press yourself back. Knees are a little bit apart, and once again, we're back to our child's pose, checking for any biases to one or the other side, and now you know how to correct it, so correct it if you're still noticing any tendencies there. Okay, slowly press up, and we're going to lie down on our backs, and now we're going to need to use the block and our lovely strap. Okay, the exercises that now follow are specific really to resetting the bones in the pelvis. So I'll be linking below in the description box to a beautiful book that some of these exercises are coming from called Pathways to a Centered Body, that talk in more detail about some of the things we're doing if you're curious to know more, okay? So we are going to get the strap and put that on the outside of the thighs. Okay, so just bring that in, and you want it to be really as wide as the width that you have of the legs when you put the block between the thighs, okay? And that's about where you want to leave that. Arms are down by your side. Now for each body, obviously our posture is different. So make sure that when you're in this position that you are properly aligned, you're maintaining your natural curves of your spine that we talked about earlier, the importance of that, but also supporting your neck in any way that is necessary. So you want to have enough support, but the least amount of support that you need. So don't put something that's going to bring your head up like this. We want it all to be nice and neutral and well aligned. Okay? So arms down by your side. You're going to take a nice deep breath in. On the exhale, gently squeeze the block between your legs. So intensity 0 to 10, 10 being the most intense. We're somewhere at a 3 or 4. Not crazy. Inhale and relax. Exhale, gently squeeze the block. Inhale, release. And exhale, gently squeeze the block. Inhale and release. Now we're going to be pressing out on our strap. So inhale, exhale, press out. And release. And exhale, gently pressing out. So still that 3-4 intensity. Inhale, release. And exhale, press out. Inhale, release. Now let's combine both of those. So inhale, exhale, squeeze the block. Inhale, release. Exhale, press out. Inhale, release. Exhale, squeeze. Inhale, release. Exhale, press out. Inhale, release. Exhale, squeeze. Inhale, release. And last one here, exhale, press out. And inhale, release. Good. Let's remove the block. Remove your strap. Okay, let's leave that next to you on the mat. Okay, you're taking one knee in each hand. We're doing Apanasana. Just making sure here, when you pull the knee in towards your chest, you're not letting the ground down to the mat. We're trying to keep the neutral pelvis. So think about the sit bones reaching down to the mat as you pull the knees in on the exhale. Inhale, stretch your arms. The knees press away from you. Exhale, pull the knees in towards you. Reach the sit bones to the mat. Inhale, release. And a couple more times. And bring your feet down. Okay, making sure the hip and the shoulder move together. We turn to the side. Press yourself up to a seated position. And we're going to do a final release and relaxation pose using our bolster or your rolled up towels or your folded up blankets or your folded up towels, whatever it is that you have. On to our final part, and honestly one of my favorites. This is a great exercise to do anytime during the day. It doesn't have to be incorporated into the practice. So take the support that you have in front of you, and you're going to align yourself so that the creases of your hips here align with the base of the support. The legs are just a little bit in external rotation, so they're a little bit open, slightly bent. And depending on the support that you have, you may be able to rest your head, or you might not. So feel free to add hands like this to support your forehead, or you can have a block or some more pillow cushioning, whatever it is that you need to feel comfortable. And you're just going to start to take some nice deep breaths, and with every exhale, just completely release in the pelvis, completely let your back release, and just let that air move from your chest down to your belly. When you're breathing deeply in your belly like this, you're going to see how that opens your lower back up and just helps everything release and let go. We're going to stay here for about a minute. Now, when you practice this on your own, feel free to stay here 3, 5, 10 minutes, whatever feels like you need on that given day. Okay, so let's just take some nice deep breaths and enjoy the moment. All right, to come out of this position, we're going to bring the hands under the shoulders, press yourself up and back onto your heels again, rest your forehead on your support. This is another opportunity to look through the crotch area there and just check, after all these resetting, realigning exercises, how does it look now? Does it look more even, or are you still having a tendency to go to one side or the other? Just take a couple breaths here. And then slowly press yourself up. Beautiful job. This concludes the practice portion of our video. Here are some tips on how to keep your SI joint safe going forward. First of all, avoid asymmetrical postures in your yoga classes. If your SI joints are inflamed, they're in pain, there is no point in forcing this. So we're talking warrior ones that are too narrow-based with your stance, right? Or any positions where you are opening a leg and trying to force your pelvis into an opposite position. That's not doing any favors anywhere on that chain. Your knee, your foot, your pelvis. So that is way too much twerking. Triangle pose where you're reaching to go down. That also, you're hanging your spine off of your pelvis. So anytime that you're using that kind of lever, if you will, not good. Okay, another important tip is looking at how you're doing your transitions. So let's say you're going from a warrior 2 position and you're being invited to come down, bring your hands down and step back into a downward dog. Make sure that shoulder, hip, heel are all moving together and rotating with you, that you're not rotating, neck first, shoulder, then the rest, because all of that is putting undue pressure on your spine and particularly in your SI joint. So connect all of these dots, move it together, bring it down, step back, always find symmetry, okay? Stepping forward, even if you are going to open into a warrior 2, rotate everything together to come up. Okay, so be super, super attentive with your transitions. Okay, you're wanting to avoid positions with excessive twisting where your pelvis stays fixed in a position and you're twisting around that. It could be in standing, it could be these seated positions like this and you're twisting your pelvis. It could be lying down on your back and you're forcing your legs to twist to one place or the other. All of that is putting undue and unnecessary pressure on the sacroiliac joints. Other positions to avoid are positions where you're going into a passive stretching situation of using your leg, again, as a lever for off of the pelvis here. So if you're trying to stretch the leg to one side and it's hanging off of the pelvis, this is a lot of pressure and it will very, very likely, not very likely, for sure, misalign the pelvis, forcing the opposite side to come up and create unnecessary pressure in your SI joint. Okay, so these positions of opening out, you might have a strap here and you're pulling into a stretch and it's just hanging there and you're spending significant amount of time in there. So folks, focus on practices that maintain the symmetry. Take some time to reset those bones, to release tension before you're going to go doing all of these crazy moves again. All right, my friends, if you like this, give it a like. Don't forget to subscribe and hit that little bell so you can stay notified of any new videos that I post. If you think someone could benefit from these workouts, then please share the link, and I'll catch you on the next one. Till then, bye-bye.